Hello, my name is Vanessa Garcia Gonzalez, and today I will be performing the head-to-toe assessment, and I have my boyfriend here today as my patient, Daniel. Daniel, do you consent to be recorded and be performed a head-to-toe assessment today?
Yes.
Alrighty, and can you confirm you are over the age of 18?
Yes.
Perfect, so I will go ahead and begin. So we're gonna go ahead and start off by knocking at the patient door, coming in, providing privacy. Hello Daniel, my name is Vanessa. I'm the nurse taking care of you today. I will perform hand hygiene and apply my gloves. I will go ahead and move the bed to appropriate working condition for me. And Daniel, I'm going to be doing a head-to-toe assessment today that has been ordered by your doctor due to you having your removal of your tonsils surgery today, okay?
Okay.
I'm going to go ahead and ask you a couple questions. The first one is, can you confirm your first and last name for me?
Daniel Miron,
And your date of birth.
January 16, 1986.
Perfect. And I'm going to go ahead and confirm by checking my patient wristband. Perfect. It matches. Okay. So now I'm going to ask you a couple more questions. Like, for example, do you know where you are today?
Yes, hospital.
Perfect. Do you know what day of the week it is?
Yes, Sunday.
And do you know why you're here? Why I'm checking you today?
For my recovery after my surgery.
Perfect. So alert and oriented times 4. Okay, Daniel. Any pain or discomfort at the moment?
No.
Okay. So upon inspection, my patient's GCS is 14. He is able to communicate freely and express his needs. Patient does not appear to be in any distress or pain or discomfort. Patient appears to be well groomed, have good hygiene, and appear in good health at the moment. Okay, so I'm going to go ahead and begin my assessment, all right? If at any point you have any questions, concerns, or are uncomfortable or in pain, please don't hesitate to stop me so I can go ahead and accommodate, okay?
Okay.
Alrighty, so we're going to go ahead and by inspecting the head. So we're looking for any bumps, lumps, lesions, scars, infestations. So patient has no infestation. Patient has a full set of hair evenly dispersed. Perfect. Now I'm going to move my way down to the eyes. Daniel, I'm going to be shining the light in your eye, okay? Do you use any contact lenses or glasses?
No.
Okay. Okay. Patient's eye equally reactive to light. Now we're going to do accommodation. So go ahead and follow this slide for me, please. Perfect. Patient's perla is intact bilaterally. Now I'm going to go ahead and inspect your eyes. Sclera is white. Patient conjunctiva is pink and moist. Daniel, now we're going to go ahead and inspect your nose. I'm going to palpate on your cheeks. Any pressure or discomfort in your brain or your head at the moment?
No.
Okay. Now I'm going to go ahead and look inside your nose. We're looking for any occlusions, discharge. I'm going to have you take a deep breath in. Now another. Nares appear to be free from any occlusions, patent, able to breathe freely. Nose is midline, septum is midline. Okay, Daniel. Now we're going to go ahead and check your mouth. So go ahead and open for me. Say ah. Stick out your tongue. Perfect. Lift up your tongue. Move it side to side. Patient uvula present. You don't use any dentures?
No.
No. Patient appears to have a full set of teeth. Uvula present. Tongue is able to move freely and is midline. Smile for me. Frown. Okay. Perfect. Patient has no facial drooping. Face is symmetrical and even. We're going to go ahead and inspect your ears now, okay? Alrighty. free of any serum or wax. Same thing on the other side, free of serum or wax. We're also looking in the back of the ears, making sure there's no bruising. And while I'm here, I'm gonna go ahead and whisper a number, and I'm gonna have you say it out loud for me, okay?
13. 10.
Perfect. Okay, Daniel, we're gonna go ahead and inspect your throat now, okay? And before I do so, I'm gonna go ahead and check my patient skin integrity, as well as his, excuse me, we're gonna inspect his, I'll come back to that. So patient's trachea, and we're also palpating for the lymph nodes. Trachea midline, go ahead and swallow for me. Perfect, any trouble swallowing?
No.
Okay, perfect. We're inspecting the skin turgor, that's what I was looking at right here. Perfect, patient appears to be hydrated. All right, Daniel. Now we're gonna go ahead and check your thorax. We're inspecting, and we would do this without patient having his shirt on. Deep breath in for me. Let it out. Okay, patient does not appear to be using accessory muscles. So we're gonna go ahead and start by listening to his lung sounds. Again, for patient privacy, we're gonna keep his shirt on. You're gonna take deep breaths in for me, okay? Perfect. Have you had any cough or trouble with breathing?
No.
Okay. We're gonna go ahead and inspect the back. Same thing, we would typically do this without a patient having a shirt. To look at also while we're here, the bony prominences like the back of the head, the scapula, the coccyx bone area. Okay? So go ahead and lean forward for me. And we're gonna have you do the same thing. Take deep breaths in. Okay, patient lobes appear to be clear to auscultation in all lobes. No use of accessory muscles. Appears to have no trouble breathing. Okay, so now we're gonna go ahead and listen to your heart sounds. And I'm not sure if I mentioned, but my patient's vital signs, which I checked in the beginning, blood pressure was 120/78. Pulse 72, respirations 15, temperature 98.2, pulse, temperature, blood pressure, heart rate 72, and any pain or discomfort, Daniel?
No.
So pain 0 out of 10. Okay, so now that we're gonna go ahead and listen to the heart sounds, okay? And we would listen to the apical pulse for 1 minute. We're gonna pretend we did, and I have my little timer right here. Okay, Daniel. So no abnormal heart rates, no abnormal extra sounds. Heart rate steady, rhythm, no gallops, and no murmurs present. Okay. while we were here, we also inspected the carotid pulse, bilateral +2 and no JVD present, trachea, midline. Okay, so now we're gonna go ahead and make our way down to the abdomen. So we would begin by inspecting, but again, for patient privacy, we're not gonna lift up his shirt. We're looking for masses, bulges, bruises. So patient appears to have we're gonna go ahead and auscultate first before we can say. Okay. Daniel, before I auscultated, I would have asked my patient, when was the last time you had a bowel movement, which is poop?
Last time it was this morning.
Okay, anything abnormal like smell, consistency, pain, or blood?
No.
Okay, when was the last time you voided? Which is urine?
Like 3 hours ago.
Any abnormal smell, color, blood, or pain?
Normal.
Okay, so we have inspected, auscultated, and now we're gonna go ahead and palpate. Please let me know if you have any pain or discomfort, okay? So patients has bowel sounds in all 4 quadrants, normal, active. Upon palpitation, patient abdomen is soft, non-distended. Let's see. Okay, all right, Daniel, so we're gonna go ahead and inspect your hands now, okay, while we're here. So I'm gonna go ahead and have you, first we're gonna start off by palpitation. So we're looking for any edema and inspection. So no bruising and no injuries on his bony prominences. We're gonna do the same thing on the other side. Inspection, bony prominences, and palpitation. Okay, Daniel, I'm gonna go ahead and look at your fingers now, and we're gonna go ahead and check the capillary refills, less than 3 seconds. Same thing on the other side. Fingernails appear to be in good, healthy condition, good hygiene, no clubbing, no denting in either of his hands. Daniel, now while we're here, I'm gonna go ahead and have you squeeze my fingers, please. Perfect. Hands up like this. I'm gonna go ahead and push against them and pull. Perfect. Move your hands nice and freely, nice and round. No injuries, right? No pain in your joints. Move back. Okay, patient appears to have full range of motion on the upper extremities bilateral, equal in strength bilateral. I'm also going to go ahead and check his radial pulse. On the other side. Radial pulse present +2 on bilateral hands. Now that I have inspected, while I'm here, I'm also going to do a little test on you. Any trouble with taste or smell?
No.
Okay. This is sharp and this is dull. Please let me know what you feel, okay?
Dull. Sharp.
Okay.
Dull.
Okay. We're gonna do the other side.
Sharp. Dull.
Okay, perfect. And then while I'm here, I'm also gonna go ahead and check your mobility for your shoulders. So go up and down. Perfect. Head front and back. Head side to side. And go ahead and push up. Push up with your, okay, perfect. Alrighty. So patient also appears to have full range of motion and strength, bilateral strength in his shoulder area. Now we're gonna move our way down to the lower extremities. So we're gonna go ahead and begin by inspecting. So we would pretend that the patient did not have his pants on, but for privacy purposes, we're gonna leave it on. And we're also gonna go ahead and check the femoral arteries. Perfect. All right, Daniel, I'm going to go ahead and palpate, and we're looking for any edema. So no bruising present, no scarring. Next foot. Okay, Daniel. I'm also going to check your pulses. So we're going to go ahead and check popliteal. +2 bilateral. And we're going to go ahead and also check the tibial. +2 bilateral, and the pedal. +2 bilateral. Patient would like to keep his socks on. So we're going to go ahead and continue our assessment pretending he does not have his socks on. So Daniel, I'm going to go ahead and check your toes. So we're inspecting to make sure that there is no skin breakdown, as well as checking the back of the heels. The bony promises bilateral. So in between toes, we're looking for skin breakdown in the back of his heel. We have also checked his capillary refills, and it's less than 3 seconds bilateral. Go ahead and extend and point your toes for me. Perfect. Go ahead, push down. Push up. Perfect. Okay. And now, Daniel, I forgot one of the top inspections. I'm gonna have you point your finger and then touch your nose, okay? Perfect. Okay, now the other hand. Perfect, okay. Alrighty, so now that we went there, Daniel, do you use a walker or a cane?
No.
Okay, I'm gonna have you stand up slowly. You're gonna walk towards me. Perfect, go ahead and turn around. Now walk. Perfect, go ahead and face me. And I'm gonna have you touch your toes. Okay, and then you're gonna go ahead and rotate your hips for me. Okay, any trouble there?
No.
Okay, go ahead and slowly take a seat. So patient appears to have full range of motion, bilateral in the lower extremities, and patient also has equal strength bilateral lower extremities. Okay, Daniel, so I have completed my head to toe assessment. Do you have any questions for me?
No.
Okay, so I'm gonna go ahead and lower the bed to the lowest position for the patient. Give him his call light. Close the curtain, take off my gloves, hand hygiene, and step out.